Hi viewers, I am Dr. Padmavathi Surapaneni. I am a practicing dermatologist and a cosmetic dermatologist. I practice in Hyderabad at Pregna Skin and Laser Clinic, Telangana. And today I want to discuss about hyperhidrosis. Hyperhidrosis means excessive sweating. Sweating is normally a thermoregulatory process. When the outside temperature or humidity increases, our body stimulates the neurologic stimulus, which causes the sweat glands to secrete excess of sweat, so that our body cools down with the sweat evaporation into the environment. And excessive sweat can be caused in any causes which can exert our body and increase our body temperatures, like increased muscular activity, emotional stress, or any serious diseases like heart attack, or in menopausal women you can see as a postmenopausal sweat and hot flashes, which can cause us an excessive sweating. How much is excessive? Like if a patient or a person is really embarrassed to go into the social situations, to give a shake hand a person, or if he is embarrassed with the stains on his clothes because of the sweat, then we can call it as a hyperhidrosis. That is the reason when we have to intervene and help the person. So excessive sweating can be a familial cause, like in families it can run, and then it can be a normal sweating process because it is in the families and in the genes. And other type of excessive hyperhidrosis can be caused with the hormonal imbalances, what I spoke earlier, and then it can cause with some medications also. So how we can tackle this excessive sweating? So if the sweating is a little bit lighter, then you get this aluminum chloride antiperspirant rolls, which you can use like whenever you required in the affected areas. Hyperhidrosis mainly we see in underarms and then palms, soles, and in more severe cases you can see on the forehead and on the scalp, as well as the upper body, like back and then chest. So if there is a localized area of sweating, you can use these roll-ons to help reduce the sweating process. If this regular sweating is rolls are not helping you, then you can go for a medicated medical grade therapeutic aluminum chloride hexahydrate sprays and lotions are available, which we give them so that you can apply once or twice in a day for a few days till the sweating comes under control. Then you can use it like once or twice in a week so that you can be comfortable. But if it is not helping you with these rolls, then the other option you have is the clinical treatments. The most commonly we use and the less invasive treatment is the iontophoresis. The iontophoresis treatment you may require like once or twice in a week initially, and then as a maintenance you can do like once in a month or once in 15 days depending on the severity of your sweat. Then Botox, as you know, Botox is a neurotoxin. The neurotoxin we use to relax the muscles. So in cosmetic practice we use it to reduce the wrinkles, crow's feet, forehead lines, and then the marionette lines, and then it's like an anti-aging muscle relaxant we use on the face. And in some neurology departments they use as a muscle relaxant where the children have a very severe cerebral palsy and then they have spastic muscles. To relax those muscles they use Botox in those muscles, and that the same Botox we can use to reduce your hyperhidrosis. We identify the areas where there is a excessive sweating, like your palms, soles, or the underarms. We do a starch test, a starch iodine test, which can identify the areas where the sweat glands are more concentrated and where you are sweating more. We identify the areas and then give the Botox on that particular areas, which will inhibit sweating for at least 4 to 6 months. You can be sweat free. And other treatment modalities are, if the sweating is not localized and if it is whole body, then the other option you have is the anticholinergic drugs. But we avoid giving anticholinergic drugs for excess sweating unless it is too much of distressing to the patient, because it may have the other side effects, like the anticholinergic drugs not only inhibit the sweat from the sweat glands, but they inhibit secretion of the other glands too, like the salivary glands and the lacrimal glands, and the patient may feel discomfort because of the dry mouth and the dry eyes. Other techniques what we use are the lasers and microneedle RF in a more deeper depth, up to 4 mm depth of penetration, can destroy the sweat glands and reduce the sweating permanently in those particular areas where the treatment was done, but it may require 2 or 3 sessions. Same as the high intensity focused ultrasound at a depth of 4.5 mm, which can target the sweat glands and then reduce the excessive sweating. Other common thing is the microwave technology, what is called as mirror dry. That is also a new technology which can reduce the sweat glands and give a permanent relief to the sweat in that particular areas. But all these are limited to small areas of excessive sweating. It is not, you cannot do for the large areas. And last technique is the sympathectomy, like that is the destruction of the nerves which supply the sweat glands. This we do if the patient is too much of distressing and then the other modalities of treatment are not working for him. So if you are suffering with this hyperhidrosis and then you are not able to tolerate and the regular over-the-counter products are not helping you, you can definitely go and check with your dermatologist the treatment options available, and then you can get rid of this excessive sweating problem.